All right. Thank you for joining us today. Today we're gonna go ahead and describe our plan to take our first small steps in increasing our on-site work. We'll go through the criteria again, what the gating criteria are to allow us to make those decisions. We'll actually talk about the data that made up our decision, because there's a lot of it, and it's important for you to see what we're talking about, and then walk through our rationale. So. Just to reset everybody, remember we are we're already in stage 3. We used to call it kind of a high stage 3 plus, because we were talking really mission essential work, which is really to protect life and critical hardware. So this transition we're going to do, we believe we've passed the first gate. We're going to transition to what would be nominally stage 3, so we're still in stage 3. But we'll start adding a few tasks that are schedule critical tasks, things that people need to be on site to do work that allows us to hold the schedule for our critical missions. Again, this amount of work is a small amount of work. It's maybe about 300 people, but it is an important transition, so we wanted to walk through with you exactly how we're going to go do that. See, I think I talk about that. Let's see, so Vanessa's going to give you a sense for what the plan is, and then we have with us today Bob Martell. Many of you might know Bob. Bob's from our occupational health organization, and he's going to actually walk through the data. So, if you look at those gating criteria, it might seem simple what it is, but actually finding the data and then interpreting the data is more complicated than it might seem. I think we're really blessed here at the center, I've mentioned it before, to have experts like Dr. Taddeo, who can help interpret, the illness or the virus itself and how to deal with it, but also people like Bob, Sean Kepperdet, and others that help us interpret the data and keep us safe when we're on site. So that'll be a good conversation. I would say, many of us are engineers and scientists, so we're used to looking at data, and with any data, there's always uncertainties and assumptions that are important, and so it's important for us to walk through those with you today. Vanessa and I and the rest of the JSC senior management team believe that this data supports our taking this next step. So that's an important why we're doing this today. I know that it's taken time for many of us just to get used to the teleworking routine. I know it did me. And the thought of returning to work on site can add additional stress. Here we are in another transition. But I want to be clear, again, that we're making a small transition here to full stage 3. And that before we take the big step to stage 2, we will carefully be tracking the data and also tracking how our efforts to protect our on-site team has exceeded. So I like this small phase-in. It gives us a chance to get ready for the process. And as you can imagine, stage 2 will involve many more of our office areas, and so that plan is still in work. We didn't take questions for this one because we're going to spend a lot of the time going through the data, so we were certain we'd be full with going through the overall plan, but Vanessa and I will continue to have these every 2 weeks. And you will also get an email today after this town hall, which will describe more details of our plan. So I've said it every time, I want to remind ourselves to be patient with ourselves and each other, right? Still, we have a hard job. This environment adds more stress to that. Make sure you discuss your abilities and limitations with your supervisors, and as bosses, let's keep reaching out to our supervisors who will be asked to carry a pretty heavy load. And with any plan, and especially now this new phase-in plan, if you are uncomfortable coming to work, if you're part of this 300 people list in this next phase and you're uncomfortable coming to work because of your concerns with your health or health of others in your household, you are not required to return, and all supervisors will be sensitive to that request. So with that intro, I'd like to hand it over to Vanessa.
Yeah, great. Thank you, Mark, and good morning, JSC. So it's week 10 of mandatory telework. I hope that everyone is doing fine and that your families are doing fine. As Mark mentioned, the center's pandemic incident response group, or PIRG, has been working over the past several weeks to develop the return to site plan. So we're going to walk through the plan, concentrating on the first phase of transition, which will start on tomorrow, May 20th. So there's a graphic, if we could go to the next chart. So everyone received this from the agency almost 2 weeks ago now. And the JSC return to site plan is developed in adherence to this guidance provided by the agency, using this framework and tailored specifically for our center. Our plan was submitted to the agency for approval, and we've been given concurrence to proceed with implementation. Our plan is a phased transition through the stages of the return to site framework. And as Mark mentioned, we've been operating at a high stage 3, and now we're working to being a full stage 3 of this framework. So in order to make this transition, we must first pass gating criteria, assessing the COVID-19 status and capability to respond in the local area. Our Health and Medical Technical Authority has analyzed the data and presented it to the PIRG and to senior staff to conclude we're ready to transition here locally at JSC. And at White Sands, as of right now, we've not passed all of the criteria. Bob Martell and Terry will cover the criteria and the data in just a few minutes. So first, I will explain the transition steps, the guidance that will apply, and how the center will be operating under stage 3. Next chart, Mike. So our transition, we will start to transition, as I said, on May 20th, which is on tomorrow. This is the start of the transition. This is going to be based on approved tasks. As Mark mentioned, we're adding mission critical tasks. Tasks for Gateway, for the Human Landing System. For SMD, we have some tasks that we're adding for the Viper rover and some technology tasks for AES and STMD, as well as continuing all of the mission essential work that we've been doing already. Employees will be contacted. We have to do hazard assessment. So there are steps that have to be taken before we actually start those particular tasks. So we're not expecting for everyone to show up on tomorrow. We estimate that we're going to phase in about 330 people to do this work over the next couple of days. The supervisors will contact the employees directly with details on when to report to site. Each transition, as we take these steps, we're going to have to go through multiple abilities to get ourselves ready, and so we're going to take our time while we do that. We're not expecting that the task will start right away on tomorrow. So how will we operate in stage 3? We have guidance. This guidance has been available and is available on the internal website. It's identified there under the COVID pane. We update this guidance as we get new policy decisions that come down. For example, we've recently updated the guidance to include a change to the face covering policy. The agency has requested that face coverings be mandatory in all common areas. So we've identified those as areas such as elevators, hallways, public entrances, when you're moving around in cubicle areas. But when you are seated at your desk, you do not need to have on a face covering. So if you're in a cubicle or at an individual office, you do not need to have on the face covering. I want you to please take the time to go to the website and read up on the guidance. As Mark mentioned, he will be sending an email that provides additional information, and specifically it is going to take you to this guidance so that you can look at what we are asking to be done while you're on site in stage 3. It covers things such as your self-health checks, that you take your temperature before you come to work. If you're sick, you should stay home. Cleaning and hygiene reminders, to wash your hands, use hand sanitizer, the requirement that we have 6 feet spatial distancing. If you cannot maintain the 6 feet spatial distancing, the requirements to have a mask, what types of respirators or masks will be required when you're doing operations, as well as the update to the face covering policy. As you have an opportunity to review that guidance, also we want to make sure that you have a reminder that if you see or have any concerns on site, the first step would be maybe to ask someone to adhere to the guidance, make a request. But if the request is not taken, then you should go to your supervisor. We have with a link to what we call the stop it chart at JSC. This is a standard practice for us. And if something is not resolved, it talks about how you can take it forward from a supervisor if there's no response, maybe to the ombudsman, or if required, even submitting it anonymously via the NSRS system. All of that is available in this guidance that's available on the website. Center operations has been very busy getting the buildings and facilities ready to go. We've been doing cleaning per standard practice, and where additional cleaning is required per CDC guidelines, that cleaning is taking place. They are about done with all of the cleaning. Mary Beth Swartz, the deputy for COD, reported this morning that they're busily finishing that up as we speak. Employees also have guidance on the types of cleaning supplies that can be used for you personally. And so there's a link to the center operations website from our COVID website that has those guidelines. We've done assessments of the cubicle areas to ensure 6 feet spatial distancing, where there could be a situation where 1 or 2 have not. They're working to resolve that. And as Mark mentioned, the majority of the office work will not begin until stage 2. So we do have time to make all of the adjustments that we need, and we're working on that right now. For all of the tasks that we do on site, we complete a hazard analysis to make sure that the 6 feet spatial distancing is observed. If it's not, we're providing PPE, and that PPE is provided by occupational health, and there are instructions for that as well. We do want to remind everyone that we have been operating in this mode for the past 10 weeks. So we do have some experience with how to do this, and things have been running very smoothly, and so we will just continue to use that process. So you may be wondering, what's the timeline for stage 3 or moving forward? I want to make sure it's clear that we will remain in stage 3 for a minimum of 14 days, and the transition to stage 2 would be dependent on the conditions in the local area as well as on site. And if we're not ready to transition, then we will not. We are continually getting an update, as you will hear from Bob, on the data. We will either remain at a stage or even consider elevating back up the framework. But right now, we will be in stage 3 until we're ready to make that transition. So Mike, next chart. So real quickly, what does stage 3 look like at JSC? So telework is still mandatory unless you have to come on site to do critical tasks, either essential or critical tasks. Employees, as Mark mentioned, that have high-risk conditions and or are not comfortable with returning to on-site will be accommodated. So please inform your supervisor if you have any concerns. For those that were in a category of work called XLV 61 for the civil servants, and what that is was if your work required you to be on site but you didn't have access because your tasks were not approved, if that project is approved, you will be allowed to come back on site. Supervisors will contact those using XLV 61 to let them know of their status. Again, we're estimating about 330 people will be added to the approximately 1,100 that are currently on site today. And so we will continue to operate with the additional staffing. So it puts us around 1,400 individuals, 14 to 1,500 individuals on site, and they will be following the guidance and the steps that I talked about on the previous page. For travel, we are still restricted to mission essential and mission critical only, and all travel has to be approved by the center director and concurred on by the NASA AA. For travel, the guidelines that are provided by the CDC are being adhered to. So if anyone goes on international travel, for example, when they return, they have to do a 14-day quarantine. We're reviewing all tasks, as I mentioned, to make sure that we have the 6 feet spatial distancing, and if we don't, and that assessment also includes occupational health as a concurror. If it's not met, then PPE is provided. All those assessments have been going on and being conducted without issue. We're asking that we minimize the size of our groups to no more than 10. We say where possible because there are certain areas, for example, like mission control, where there are going to be more than 10 people inside the flight control room. However, we have also assessed and know that the spacing between the individuals is sufficient. So for mission control, crew training, we've looked at all those activities to make sure that we have mitigated the risk. We have already been told that all large gatherings are canceled, no conferences, you can participate virtually only. Visitors are limited to official visitors only, and right now we're working on the cafeteria. We've been advised that the current vendor may not find it financially supportable to come back to site during stage 3 or stage 2. So we are looking at food trucks. Those would be approved by the health department, so make sure that they are meet all of the standards before we allow them to come on site. But the food trucks may be able to come as early as Tuesday, the day after Memorial Day. The gym will remain closed during stage 3 and 2. We're looking at opening the gym in stage 1 with protocols in place. You may have seen on the news how some of the gyms locally are making sure that they have enough spacing, enough cleaning supplies available. And then the daycare, we are working with the on-site daycare, and we're looking at reopening the daycare in stage 2. So as Mark mentioned, we do know that for stage 2, that's down the road, to move to stage 2, which would be bringing more folks back and encouraging still telework, that we need to have certain parameters in place, and so having daycare, it would be one of them. So as you review the guidance and as things move forward, if you have any questions, please contact your supervisors. If the supervisors don't ask questions, don't have the answers to the questions, there are some frequently asked questions that we have identified on the website. You can go there as well, and then contact your directors or program managers. As Mark mentioned, before we would transition to stage 2, we will have to develop a plan that would be reviewed by the PERG, by senior staff, by many others, including headquarters, before we implement it. So we want you to understand that all of the steps that we take, we're very deliberate in making sure that we've thought about all concerns and issues before progressing. And we would not do that unless the data says so. So with that, I'm going to turn it over to Terry and Bob to talk about the data.
Okay.
Thank you.
Thanks, Vanessa. Just a brief preamble before Bob gets into the nuts and bolts of the data. I hope all of you out there are well. I also hope in the stressful time you're taking the time to implement some self-care at home. And I would also encourage you to avail yourself of our employee assistance program if necessary, if you're really finding you're feeling overwhelmed or having difficulty managing the stress. So I want to emphasize that our occupational health team, in particular Bob Martell, has spent the last several weeks reviewing all of the data that's out there in regard to COVID-19 and determining which data is relevant, which data is reliable, and measuring that and matching that against the criteria that we have been provided with the White House's plan and with headquarters in terms of achieving those gates that allow us to restore the center to normal operation. And as you listen to what Bob is going to share, please keep in mind that we will move cautiously forward through these stages. I want to emphasize that as Vanessa did, we've been successful so far in protecting the workforce that has been coming on site. We have no evidence that there's been any transmission of the disease between folks here. And I know that Center Ops has got a robust capability in place now to do any remediation or cleaning that might be required. And as we move through these stages, it'll be a pause, and it'll be at least 2 weeks, and we will evaluate where we are. And if there are lessons to be learned, we will apply them. If there are breaks somehow, we'll fix those before we move on to the next stage. So I want to emphasize to folks that we are not moving into this blindly, or we're not going to do this recklessly. It's going to be very carefully monitored. Let's see, so ultimately the goal is going to be to reduce the risk of exposure to COVID-19 to as low as reasonably practicable. The risk will not be reduced to zero. That won't be possible, but I want to remind folks that in our daily lives we are accepting some risk, and of course that varies from person to person, but when you get in your car and drive to work, you're assuming some risk. There's risk in eating out, whether or not you're going to get food poisoning from the meal. But because of between our behaviors and other mitigations like vaccines, et cetera, engineering controls, we reduce those risks to manageable level. That's where I see where we're going to be going with COVID-19. It'll be like other infectious diseases out there that haven't gone away. Right? HIV is out there, hepatitis is out there, E. coli is out there. But what's happened is that, as a society and as the center, we've learned to manage those things, and so that ultimately is going to be the goal: is we reduce the risk to a very manageable level until a vaccine or some other treatment becomes available. So. That's what we do here. We manage risk. We do it for human spaceflight. We're going to do it with this as well. And so finally, I just want to reemphasize, all of you out there play a big role in taking personal responsibility for monitoring your own health, staying at home if you feel ill and seeking medical care, practice hand washing, wear masks, face coverings, with respirator, whatever is required either for the just coming to work situation or whatever tasks you're engaged with. And we will get through this ultimately. So with that, Bob Martell, you have the floor.
All right. Thanks, Terry. Good morning, everybody. And Mike, if we could go ahead to the next slide. So I just wanted to point out that since we started this 10 weeks ago, that our strategy has been to reduce our team's exposure to SARS-CoV-2, which is the virus actually responsible for causing coronavirus disease 19 or COVID-19. So over the past couple months, we've implemented a hierarchy of controls to control the risk, so we can maintain those mission essential and critical work that we're supposed to do. Collectively, those hierarchy of controls reduce the risk to as low as reasonably practicable that Terry had mentioned. So our hierarchy of controls, you see them up there on the screen. We have people, if they're sick, they stay home. We maintain spatial distancing. We've been achieving that through primarily through telework, but here on site, we've been doing those hazard analyses that Vanessa talked about to make sure that we keep people apart. Good hygienic practices, mandating the use of masks when we're working close together, face coverings when we're out in common areas, and PPE when appropriate. And next slide, Mike. He's there. So there's a premise in public health that we think globally but act locally. So what we've been trying to do is understand the data to understand the relative risk wherever our team is working. And our team works all over the planet. We have people obviously here in Houston. We have our folks out in Moscow. We have people traveling to MAF in New Orleans. We've had people traveling to Denver, Los Angeles, to SpaceX, and even in our homes. We've only been approving mission essential travel. We've been working with our contractors and commercial partners on these hierarchy of controls and applying these strategies wherever our work takes us. So as we prepare to work on site, we're going to continue our understanding of the risk and consider any additional measures that we can implement to help reduce that risk. So next thing we're going to talk about is NASA's framework to to return to work on site. And we're going to talk a little bit about the data in context. Next slide. So this is the guideline, the NASA framework for returning on site, and it incorporates the guidelines for opening up America again that was released by the White House several weeks ago. So in the next series of slides, we're going to talk about these gates, the metrics associated with the gate, but most importantly, the data that we're using to evaluate those gates in context. And I would remind people as we go through the data, don't focus on any one gate, metric, or mindset. We look at all the data collectively to make the best decision possible. Next slide. So this is the gating criteria. This is what was provided by the White House. And these were proposed state or regional gating criteria, which we have adopted locally as well. So these are the gates that we need to satisfy before we move to the phased opening, or from 3 heavy, 3.8 to a stage 3, as we've called it. And I'm not going to go through all these because we're going to repeat these on the different slides, but the 3 gates are going to be symptoms, cases, and hospitals. Each gate is associated with a couple of metrics. And what we've done is we have identified and analyzed data that's appropriate to the metric using local data wherever possible. So the first gate I'm going to talk about is symptoms, and the gate metric is a downward trajectory of influenza-like illness reported within a 14-day period.
Mike's got to change the chart. Yeah,
Yep, next chart, Mike.
there we go.
There we go, thanks.
Yeah.
So let's talk about why, if we're talking COVID-19, why are we looking at influenza-like illness? Well, as Dr. Taddeo could probably explain better than I could, but mild cases of COVID-19 look very similar to influenza-like illness. So we're at the time of the year where influenza-like illness should be decreasing. So, and out there, the CDC and the state has sentinel providers, and these are a network of state and local health departments that look at these diseases and provide the data to the state and provide the data to the Centers for Disease Control. And it's representative of the area that we track. So if we were to start seeing an increase in influenza-like illness, it would cause us pause and say, hey, is this really influenza-like illness, or is this really an increase in the symptoms of COVID-19, but very mild and would garner further attention? So we use a variety of data to evaluate the metric, and those are listed there, but instead of reading them, I'm just going to go ahead through each one. So next slide, Mike. And again, the metric is a downward trajectory of influenza-like illness reported within a 14-day period. So this is the data provided by the Texas Department of State Health Services. This is as local as this report gets. And we look at this report compared to prior years. And like prior years, we continue to see a decrease in the cases of influenza-like illness, which is a positive sign. As a matter of fact, we've actually had a downward trajectory for the last 7 weeks. Next slide. For the state of New Mexico, and this is a graphic from the Centers for Disease Control, New Mexico has stopped releasing their influenza-like illness report on a weekly basis, likely because there is almost virtually no activity going on in the state, and they've just decided to discontinue their report. So that, again, is a positive sign. If there is no report, then there's really no activity to speak of. Next slide. So this is one of the newest ones that's been reported, and the metric is a downward trajectory of COVID-like syndromic cases reported within a 14-day period. So when we first presented this chart, Mark asked, what's syndromic? So syndromic is a syndrome is a series of symptoms that would classify a disease. Accurate description there, Dr. Taddeo? So again, in a lot of cases, these overlap influenza-like illness, but as we understand the disease more and more, we're adding more symptoms onto there that differentiate this from influenza-like illness. So again, the sentinel providers who have been given that data, they report on it. And as you can see in this chart, we have seen that downward trajectory in COVID-like illness over the past 6 weeks. So again, the first gate was symptoms, and so when we look at all the different metrics that we have and the analysis for that, we can sit there and say that, hey, we've met the criteria for symptoms. We've seen that decrease in influenza-like illness and also in COVID-like syndromic illnesses as well. So the next slide, Mike. So the second gate is cases, and the gate metric for this is a downward trajectory of documented cases in a 14-day period. There is an alternate metric called downward trajectory of positive tests as a percent of total tests within a 14-day period. But unfortunately, that the local health departments, while they report how many daily cases we have, they don't report how many daily tests are being done, so we cannot calculate that ratio. It's available at the state level, but again, that just doesn't give us enough granularity to make a local decision. Next slide. So this is a very, very busy chart, and I'm going to slow down a little bit here and walk through this one. So this chart is essentially a mirror image of the chart that's provided by Harris County Public Health. So if you were to go to the Harris County Public Health dashboard, and they actually changed the graphic again this morning, they report the number of cases going all the way back to February when this first started. So when there's two things that we do. Is one, we look at a 7-day moving average, and we use that as an early warning if we think that things are trending the wrong way. It causes us to look at the data more closely. But the other one that we look at is the 14-day moving average, and that is the one that we look at to see if we satisfy the criteria. So if you look closely at the chart, you'll see that there's two areas. There's the first block that says data being utilized to determine a 14-day downward trajectory. And you'll probably notice that that data is a couple weeks old, and I'm going to explain why. Harris County updates their data on a daily basis, and they update the data retroactively. So it's not uncommon to see data from 2 weeks ago being adjusted upward or downward, and I'm going to get into the specifics of that a little bit more. So the short version is that the last 14 days worth of data is incomplete, and we don't think that that is good data to make a decision from. So again, this is just one data point, and this is just for Harris County, but based on that, we do see a slight downward trend in the 14-day moving average, which is why we consider this having met that criteria for Harris County. Next slide. So here I'm going to talk a little bit with the differences in reporting between Harris County and the other jurisdictions. Harris County has implemented what they refer to as an epidemiological hierarchy to classify each individual case. So Harris County will classify the case based on either the date of disease onset, the date of diagnosis, or the date of laboratory result. So what does that mean? Well, I think an example is probably the best way to show what that means. So if Harris County gets a lab result in and the lab result date is May 15th, that becomes the case date. That data will be handed to a case person who will start interviewing the person and interviewing close contacts. And if in the course of that investigation they determine that the symptoms started on 5/11, the case will actually be backdated to May 11th, which is the date of disease onset. So it's quite possible for cases to be classified, reclassified several times before they settle in on it. And for that reason, we see the Harris County data changing every day. Last night when we were going through the data, out of the last 10 weeks, there was probably 50 changes in daily counts. So it's a moving target. So how does that compare to other health departments? Well, other health departments either use the day that they get the notification or the day that the lab specimen was collected. And while it's not as epidemiologically accurate, it is at least standardized, and we don't see those numbers for the other counties shift as much. So next slide, Mike. So let me give you another graphic example. So these are two screenshots from the Harris County Public Health website taken 5 days apart. And when you look at them quickly, you'll look that they look almost identical. But if you start focusing in on the last 14 days worth of data, you'll see that the data changes somewhat. And as a matter of fact, if you were to compare the time period from May 8th to May 12th, back on May 12th, they said there was a total of 248 cases for that 5-day period. But then 5 days later, for that same period, the number of cases actually jumped to 344, so nearly a 33% increase. So as the data is delayed in coming in, that's how Harris County shifts the numbers. Next slide, Mike. So we realize that not everybody lives in Harris County, and just kind of that we actually learned back during Hurricane Ike and Harvey that a lot of our employees live in Galveston County, so we've been tracking the Galveston County data as well. And their data, while the number is low, at least it is consistent, and they don't do daily changes. And again, their data is trending downward for the last 14 days, which is a positive sign. We've also started looking at Fort Bend County. Next slide, Mike. And Fort Bend County gives us a county, while not as many employees work there, it's probably the second most populous county in the local area, second to Harris County. So it's good to track their data. And again, we're seeing that 14-day downward trend. Although the 14-day trend is near neutral, but it is slightly downward. So collectively, between the Harris County data, the Galveston County data, and the Fort Bend County data, we are confident in saying that we're seeing a downward trend in the number of cases. Next slide. As Vanessa mentioned earlier, for Doña Ana County, it's not as the news isn't as good, and we've seen a upward trend. I would like to point out, though, that Doña Ana County didn't start seeing their first cases until late March, where we were seeing our first cases in February. So with that late start, we're seeing that in a lot of the smaller communities. And they will peak and they will have that downward trajectory just like the other counties. We've looked at the public health measures that have been instituted by the state of New Mexico and Doña Ana County, and I'm confident they're going to start seeing that downward trend here very, very soon. So with all the data that we've looked at is that these are all lagging indicators. They tell us where we've been and not where we're going. And with the delays in the reporting that we see, they're not very real-time indicators. Next slide, Mike. So one of the real-time indicators that we do have is the number of admissions to the hospital for COVID-19. And this data is real-time. We can get the data that's up to date from yesterday. And this is reported by all the major hospitals within the Harris County and Galveston County area. So it would follow that if you saw an increase in the number of cases, you're going to see the commensurate increase in the number of hospitalizations. And if you look at the data for hospitalizations, we're not seeing that. So when you look at all the data collectively for the number of cases and seeing that downward trajectory, we're confident that we're progressing well in that metric, and that's why we consider that metric green. Next slide, Mike.
For JSC, not for White
For
Sands.
JSC White Sands, yes, correct, thank you.
Not for White Sands.
Not for White Sands.
Yeah, yeah.
So the third gate is hospitals, and so the metric is to treat all patients without crisis care. So 2-3 months ago when we started all this, the whole premise was to flatten the curve, and the idea was that we did not overwhelm the healthcare system. So that is an important metric back then, and it is an important metric to follow as we go forward. And we don't want to make sure that that hospital care is available for all people. So for this metric, we actually have a series of data. Mike, next slide, please. And so what this slide shows you for both the Galveston County and the Harris County area, so these are all the hospitals that report. These are the number of ICU beds that are available. And you can see that for the data for the last couple weeks, that it remains relatively flat, and we are not anywhere near our maximum surge capacity. And recently, the CDC has released new guidelines for this metric that we'll be updating for the next week's charts, because now they actually have a percentage, and we'll incorporate that going forward. That just was a change that came out late yesterday. So next slide, Mike. So along with ICU beds, we also look at how many ventilators are available, and I'm sure that we've seen in the news report that this was a very critical area, and I know that NASA has contributed into making a rather rapidly built and very inexpensive ventilator to help the cause. So, but it's still a metric that we continue to track, and again, in Harris County and Galveston County, there are still plenty of ventilators available, both pediatric and adult. Next slide, Mike. So unfortunately, my charts aren't nearly as nice looking as C-Trac's charts, but we have been looking at the data for New Mexico as well. And my thanks to the folks out at White Sands, Eric Wershing, who's provided me the data from New Mexico, and we've been able to track the data. And again, in the Diana County area, there are plenty of hospital beds and ventilators available. Next slide. To confirm that data that we get from the New Mexico Emergency Operations Center, we'll also look at the information that we get from the Joint Information Center for Diana County. And again, they too are reporting available ICU beds and ventilators in their area. And next slide, Mike. We also understand the close proximity of White Sands to the El Paso area, so we've been actually tracking El Paso data on a daily basis to look at the number of cases that they have. And we look at the availability of hospital beds and ventilators in that county. So the state of Texas, if you were to go to the Texas dashboard, there are some little tabs at the bottom, and one of the things that you can look at there is what they call trauma service areas, or TSAs, and they report the number of beds and ventilators available. And looking at that data indicates that there are beds and ventilators available in the El Paso area as well. So that's a lot of data, and it's sometimes a little bit hard to digest it all. But again, it's the best data that we have available. We'll continue to look for new data sources and new ways to evaluate the metric as we go forward and we start moving through the different stages. That's it.
All right, thank you, Bob. Thanks, Bob. Great work. Thanks, Bob and the team. Maybe I'll just summarize real quick. I would say that for JSC, we're going to transition to the nominal stage 3. For White Sands, we're not ready to do that based on the data that Bob showed, especially the case data. And you saw some of the subtleties there, but that shows you, we're going to look at the details of each of those criteria to make a decision, again, acting locally. And at this moment, we think JSC is ready, but White Sands, that area, not yet. So, and that's the details we look at. I hope that as Bob went through that, you realize the depth that these folks have penetrated the data to understand it. And I especially liked his conversation and the team's description of what's happening in Harris County, because you could look at that chart and look at the end of it and go, wow, it's plummeting, right? Everything's awesome, if you did not understand how they're actually treating the data and updating it. So these guys have done a great job, and I think given that we understand the data we have and how to make good choices around it. So again, that's our plan. I would, maybe you're wondering, am I one of these 300 people? Well, your supervisor will reach out to you and it'll be clear to you whether you're on that list or not, so you won't be surprised. As all of us have said, and you can see that it's going to be complicated. These metrics, at least the case data metric, is complicated. That we're going to assess that as we go at a minimum 2 weeks, but we'll see if even after that the data gives us confidence, and we also think we're ready on site before we transition to another stage. With that, one other thing that I would like to mention, though, is I think most of you know, but we are heading toward a launch of Demo 2 on the 27th of May. We have a big flight readiness review this week, actually Thursday and part of Friday. I haven't gotten the latest weather report, but I know that technically the teams have done an incredible job. And at this moment, we're not working any big technical gaps. So look forward to that review on Thursday, though, and Friday to make sure. And we might be heading for a very exciting launch at the end of May and getting back to launching Americans from the U.S. And supporting ISS. So it's going to be a great month. Anyway, thank you for everything you're doing. Thank you for taking the time to listen to us. You'll get, again, an email which will provide lots of links with a lot of the stuff that Vanessa and these guys described to give you more information. And we will talk to you again soon. Thank you.